Now let's see what the most common risk adjustment diagnoses seen in paraclinical tests reports are. Here are the most common ones seen in CT or MRI of the brain: calcification of basal ganglia, brain atrophy, brain degeneration, demyelination of the central nervous system, adenoma of pituitary gland, empty sella syndrome. Any mass located in the cranial box is a risk adjustment diagnosis. The most common MRA diagnoses seen in an echocardiogram are calcification of thoracic aorta, atherosclerosis of thoracic aorta, pulmonary hypertension, systolic heart failure, cardiomyopathy. The most common MRA diagnoses documented in a chest X-ray are calcification of thoracic aorta, atherosclerosis of thoracic aorta, plaque of thoracic aorta, atheroma of thoracic aorta, dilation of thoracic aorta, ectasia of thoracic aorta, aneurysm of thoracic aorta, lung fibrosis, interstitial lung disease, emphysema of the lung, blebs of the lung, bulla of the lung, chronic obstructive pulmonary disease. The most common MRA diagnoses documented in a CT or MRI of the abdomen are calcification of abdominal aorta, atherosclerosis of abdominal aorta, atheroma of abdominal aorta, plaque of abdominal aorta, dilation of abdominal aorta, aneurysm of abdominal aorta, atherosclerosis of renal artery. A CT or MRI of the lumbar spine can show the following MRA diagnoses: spinal muscular atrophy, ossification of posterior longitudinal ligament, calcified abdominal aorta. An arterial Doppler of the lower extremities will be indicated when the ankle brachial index or ABI is abnormal. The most common MRA diagnoses noted in an arterial Doppler of the legs are peripheral arterial disease, stenosis of artery of lower extremity, occlusion of artery of lower extremity. All diabetic patients need regular exams of the back of their eyes. That is why they have an annual screening test called funduscopy, or ophthalmoscopy. The most common MRA diagnoses documented in the funduscopy report are diabetic retinopathy, vitreous hemorrhage, exudative or wet macular degeneration. The most common MRA diagnoses that come from lab test result are thrombocytopenia, thrombocytosis, neutropenia, homocysteemia, GFR value less than 60 that can be documented in the notes to support a chronic kidney disease stage 3 or greater.